Hey everybody, and welcome to the Dr. Mom Show. It is Dr. D, mom of three, right here in the flesh. I'm so excited that you're joining me on this episode. We are in season 4, whoop whoop, still in the month of January. Thank you again for joining in today. I'm so excited because I'm going to be starting a series. There may be some intermittent guests in my series, but I'm starting a series essentially from the womb to the birth of your baby, how things go as a pediatrician, what you need from the time you're in the hospital and how your baby develops and things that you need to look for. So today I am talking about what do I need for the hospital? What do I need for the hospital? Oh my goodness, it's such a stressful time. But today we're going to go over some things. Of course, everybody is a little different because sometimes it may be a total surprise and sometimes people may be prepared and have time to get things situated. So if you have time to get things situated, definitely utilize that time to get stuff situated. It is so important to do that. Of course, remember here on the Dr. Mom Show, it is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely make sure that you're getting your medical advice or your child's medical advice from your physician or your child's physician. And today I'm so excited because I'm also going to have 3 special guests. You guessed it, the Tripsies, my triple threat, my threes. They're so awesome. They're so sweet. So they'll be coming in for a special question today in the middle of my talk today. But again, we're going to jump right in this again because we are looking at what mamas should take. And this is not important only for mamas. This is for mamas' support person, their birth coach, if that's what you're calling yourself, your right hand man, you know what I mean? For everybody to be prepared. So number one, I just want to tell you, if you have time to prepare, and it's never too early to prepare, you can always start getting your bag packed, your bag going. It does not have to be when your water breaks or when you're having contractions that you start getting your stuff ready for your hospital stay. Now, a lot of people talk about what's called a birth plan. Now, a birth plan is something I always tell people, if you make up a birth plan, that is something that you need to realize that there will be changes that happen because stuff happens. Some people come in, they're laboring, there may be what's called decelerations in the baby's heart rate. So for example, if the umbilical cord is around the baby's neck, there may be decelerations. If there's enough decelerations, the OBGYN will probably recommend a C-section if the birth is not progressing, or if you have, again, just a birth that isn't progressing vaginally. Again, we don't want mom to be stressed. We for sure do not want the baby to be stressed. So important. So again, when you come up with your birth plan, of course, is usually before, so pre-partum or pre-labor, if you want to call it that, where what your plan is if you're going to a special class, if you have a birth coach, whether that be a friend or a spouse, what you're going to do during the birth of your child, whether it's vaginal, whether you want to do it natural, no pain medicine, whether you want to do a home birth, whether you want to do I got my special guest came in again, whether you want to do a C-section. And like I said, sometimes there are emergent situations. So with your birth plan, definitely talk to your OBGYN. It's always nice to have your OBGYN involved in your birth plan so they're aware of what your expectations are. But it's also important that your OBGYN clarifies, how your pregnancy is going. If things may happen, they can answer questions about your birth plans, because let me tell you something, you can imagine the smoothest delivery or C-section ever, and birth is something that is random in the sense of certain events can happen. It's very spur of the moment that things can happen. So birth plans can definitely go off course. Do not be deterred that your birth plan may not go perfectly. It is okay. That is just natural. Just, if your birth plan goes perfectly, kudos to you. So first of all, I'm going to start off with mamas. So mamas, what should you pack? So first of all, make sure you got yourself together, that you're taking time for yourself. Of course, one of the biggest things is make sure you have your insurance card, and your driver's license, some sort of photo ID. This is so important because no matter what, even if you're in labor, they're going to hit you up about your insurance. You know what I'm saying? Because the doctors got to get paid. The hospital bills got to get paid. I know you don't want to pay for that out of your pocket. So make sure you have your information in your wallet and make sure your wallet is in your bag. So the other thing that's important is some people may have sensitive skin. So if you have sensitive skin and you certain things that you want to use, so anything that's personal, any personal toiletries that you may have, a specific shampoo, your toothbrush, certain toothpaste, conditioner, lotion, soap. Don't forget chapstick. Listen, I need my lip gloss because these lips, you know what I'm saying? I got to take care of these lips. And mamas, you got to take care of your lips. So make sure that your lips are taken care of with your lip gloss or your lip balm. If you wear glasses, make sure you have your glasses or your contacts. Make sure you have your contact solution. Of course, make sure you have, again, talking about toiletries and hygiene, make sure you have your hairbrush or your comb, whatever you need, your ponies, your ties, your clips, whatever you need for your hair, make sure you have it, because I know I have a certain hairbrush that I like, and that's the only brush I brush my hair with. Sometimes my little girl tries to take my brush, but I let her know what's up. We got her own hairbrush for Christmas, so thank God she loves her little hairbrush. It's pretty awesome. I kind of want her hairbrush now. So make sure you have all your stuff for your hair. The other thing is as far as clothes. So usually you get a hospital gown at the hospital, but sometimes people want to be in their own nightgown. They want to be in their own pajamas. One important thing is a robe. Listen, you don't want to try to get up and walk the hallways with a gown on. Have you seen a hospital gown? A hospital gown has a tie in the back, and a lot of times it covers things, especially if you tie it correctly, but sometimes it does not. And you know, as mamas, after we have babies, sometimes you can be a little off. If you're on pain medication, you're in so much pain, you don't even care, that you're like, whatever, that my bum's hanging out. But make sure you take a robe, because I had my robe. It was nice, cozy, cuddly when I went out to walk in the hallway, and at least you know that it's covering your stuff. You know what I'm saying? Plus, a robe is nice because if you're breastfeeding, it's nice when you're in the room. You don't necessarily have to be wearing anything on top, that you can just open your robe and put your baby to the breast if you are breastfeeding. Even if you're not breastfeeding and doing formula, that skin-to-skin contact is great for your baby. So again, doing that skin-to-skin contact, again, just opening your robe, putting the baby on your chest, getting that skin-to-skin contact is super important. Again, you can also take some clothes. Of course, you want clothes that when you're leaving the hospital, you have clothes to leave, because I'm sure you don't want to leave in your hospital gown. So make sure you take clothes, whether you want extra clothes also while you're in the hospital, and of course, the day that you're leaving. Make sure you take underwear. Please take underwear, because in the hospital, they give you these like crazy, like, granny panty, like knit underwear. So take some good cotton underwear that are sturdy. Let me tell you something, it ain't no time for thongs, you know, when you're in the hospital, because you need something that's going to support you. Sometimes you, that's my baby coming in, checking on me. Sometimes you, may need to wear a pad afterwards, because after a vaginal delivery, after a C-section, you know, sometimes you may have bleeding, sometimes you may have spotting. So definitely, if you want to take your own pads too, the hospital provides pads, but let me tell you, it's very bulky. So for any moms out there who usually wear a tampon, I mean, you're going to have an extra like log under there with their pad. So if you prefer like a thin pad or one that's a little bit more comfortable instead of bulky, you can take pads. Remember to take socks or slippers if you prefer. Of course, the hospital normally provides cozy little socks for you with little grips. That's something that's important. If you are taking socks or slippers, make sure they have some sort of grip, because most hospitals, they have tile on the floor, so it can get a little slippery. And then, of course, again, going back to breastfeeding, it is important for you to take a bra. If you have a bra, if you do not have a nursing bra or a bra to help breastfeeding, and that's just a bra that kind of either the strap opens up or may have a little detachment in front of the cup, that instead of you taking the whole side of the bra off, it's a little bit more convenient. Or like I said, just have your robe on, and even if you have your bra underneath, you can still breastfeed easily, or if you just want to wear the robe. The other thing is that make sure you have any emergency contacts, because if something happens, God forbid something happens, let's say you're a single mom and you're delivering a baby and something happens, at least they will know. So keep that with your identification. And then of course, anything for yourself. So make sure you don't forget your cell phone if you have one. There is a phone in the room. And make sure, of course, you don't forget your charger. And of course, sometimes moms are there for a longer stay. Like for example, moms who've had a C-section usually stay longer in the hospital than moms who've had a vaginal delivery. Of course, depending on how the C-section went, and of course, how the babies are doing, of course, how mom is doing. If you have preemie babies, they're staying in the hospital longer. If mom isn't doing well, staying in the hospital longer. So definitely take something that's entertaining. So like if you have your earphones, if you have a game, anything like that, some Uno, you know what I'm saying, some card games, those are great ideas to take, because remember, essentially baby like sleeps and eats. That's what they do. And mamas, remember, during this time, you should be getting your rest. Playing games or anything like that should not take the place of getting rest while your baby rests. You want to make sure that you're getting enough rest. So right now we're going to call in the first person and see, we're going to have our first guest. So let's hear from the triplets what they think I needed when I went to the hospital, because again, today we are talking about what do I need for the hospital when you're going, whether it's a vaginal delivery, whether it's a scheduled C-section. So let's hear from them. We are going to do this in birth order. So let's start off with baby Luke. Come on down, baby Luke. Here he comes. Hello. Tell everybody hi.
Hi.
What's your name?
Luke.
All right. So baby Luke, what do you think mommy needed to take to the hospital when I had you?
Pillows.
Pillows. Yeah, I like it. Ding, 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 ding. All right. Isn't he so cute? So adorable. It's my big boy. All right. So next we're going to move on to who your support system is. So if it's your husband, if it's your best friend, if it's a sibling, you know, they want to pack a bag too. Now, normally it's a little bit more convenient for them to come and go, because obviously if you just had a baby, you're not going to be coming and going. You can't drive any place. So worst case scenario, if your spouse or your friend didn't get to pack a bag and it was something that was spur of the moment, at least most of the time, your support system can drive home and get something else. So make sure that they have money, because in case the food at the hospital is not good, that they can buy you something. Or if you crave something or want something else, you know, they can get that for you. Make sure they also have clothes to wear. Make sure that they also bring their toothbrush and other toiletries, their hairbrush, socks, shoes. Of course, make sure the person who is supporting you brings a camera. What's nice right now is majority of phones have a camera on them. So if you forget, like you're into like an awesome big camera, it is okay. If you forget it, do it on the phone that you have. Of course, a video camera, if you want to tape something, again, same thing. Phones usually now have a video recorder on them, so it's more convenient instead of you traveling with everything. Of course, make sure they bring chargers for everything. Snacks are also super duper important. For everybody, pack your favorite snacks. They can pack their favorite snacks. And of course, for the two of you, you want something that's cozy for you, whether it's, again, clothes or a robe, your socks, slippers, things that are homey to you. Now, we're going to call in my second child, my middle baby, who came out second. Now, let's hear from baby Ethan. Baby Ethan was number 2. Hey, baby. Hey. What's your name?
Ethan.
And what do you think mommy needed to take to the hospital when you were born?
A bag.
A bag! Yes! You have to have a bag. Thank you very much. A bag. He's so sweet. So definitely going back to speaking of what is cozy. So of course you want to get something that's nice and cozy for yourself. You want to make sure you take something that can make you feel at home. A lot of moms want to kind of get that safety of something from home. Now, I will say I took my own blanket and pillow. That was my thing, because even when I trained to be a physician as a resident, we have to work night shifts and we sleep in the hospital, and I just feel like a lot of times the sheets are starchy. I remember when I used to be a resident and I sleep with my hoodie on. I sleep like everything on I wasn't touching anything. I was all curled up. So if you're kind of like me, take your own pillow. I mean, there's something about my pillow. I love my pillow. I love cold pillows. Anybody out there who love cold pillows? I love cold, refreshing pillows, but I still love to snuggle up in my blankets. So I took my own blanket and I took my own pillow, and it was something that was just cozy and homey for me. I just loved that a lot. So that's something to make sure. And again, I'm not talking about take your king size pillow, just a little regular pillow is completely fine, and a little blanket. And again, this is where your support system comes in. This is something that they could keep a bag like in the car. So you have it. So this is an extra pillow and an extra blanket. It's not like take your big comforter or your quilt. So now we're going to have our final person. No, she's super special, baby Alina. She's our little girl at the hospital. But again, you just want to take a sheet or a small cover, and again, a pillow with you if you want to be a little bit cozier. All right, and finally, let's hear she's a baby. She is baby girl Alina, tried and true, our only baby girl. Here she comes. Come on down, baby Alina. Yes, hey, Lini. This is my twinsy, my mini-me. Hey. Okay, baby girl, what do you think Mama had to take to the hospital when you were born, or something important?
A blanket.
A blanket! Ding, 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 ding. I did take a blanket. Thank you, baby girl. Thank you, Mama.
You're welcome. All
right, and finally, don't forget about the super duper special person who's arriving while we're doing all of this for whether it's 1 baby, 2 babies, 3 babies, 4, or even 5 babies. Don't forget the things that you need for the baby or babies, because this is a bag again that you can pack super early. So of course, make sure you have some onesies for the baby. You want to have a couple of onesies so you can change them. If you want to do photos at the hospital, take an outfit for their photo. Of course, you want to take their going home outfit, because that's really special. What a special day for them. Of course, if you have any swaddles or blankets that you want to take for them, definitely take them. Make sure you have a hat for them. Normally at the hospital, you do get provided with some swaddles at the hospital that they swaddle the baby in. And of course, usually a hat we put on the baby after birth, because they can lose a lot of heat from their head if they're not wearing a hat. So again, very important. There's some clothes, some sleepers, some little socks, whatever your outfits that you want them to wear for all their photos, definitely those. Of course, if you are planning on taking them home, which you are, better not be leaving your babies at the hospital. You definitely want to take your car seat or car seats. Definitely do it. Make sure, if you're not sure how to buckle up your baby safely in the car seat, that's so important. Just so you know, if your baby is small, like low birth weight, premature, anything like that, they will have what's called a car seat challenge prior to being discharged from the hospital. And that's just the nurses putting them in the car seat for a certain period of time, making sure their oxygen level is good, making sure they're safe. So again, if you have any questions about the car seat, again, especially with buckling them up, because it's so important how you buckle them up in the car seat, because if you put buckles in the wrong place, they can get abdominal trauma. That bottom buckle, you're supposed to lift up to kind of like that nipple line. If it's lower, again, if there's an accident, that can cause abdominal trauma because it's just in the wrong place. And there's lots of places, police station, fire stations. You can even go to baby stores. Even at the hospital, again, they can help you out to show you how to put the car seat, in, how to buckle up the baby. So important. So these are big things. Just so you know, at the hospital, usually they have bottles. If you're doing formula, usually they have like pre-made formula, so the babies get the little bottles with that in it. Normally there's about 2 ounces in that bottle that's already pre-made. If you want to take your own formula, like if you have something special you want your baby to use, feel free to do that. Make sure you take your water with you, the appropriate water for the formula to make it. Of course, again, mamas, if you're going to pump from the time you're at the hospital, to have your pump with you. Some hospitals do provide a pump for you if you need one. Also, make sure to talk to your OBGYN if you do need a pump, because OBs can write a prescription for a breast pump. Most insurances will cover it. So important. And if you want like the little bags to store the breast milk, that's something else too that you can do. So these are all very important things for you to take, as you have seen and heard firsthand from my 3 little ones that, for them, they thought it was important for me to take a bag, which they know I take my big bag everywhere I go. So yes, check, you need a bag to put everything in, and then a pillow and the blanket. They know me so well because I am very particular about my own pillow and blanket whenever I go places. So I love that. So I hope this was helpful. Any mamas listening, whether you're new or you have a friend who is pregnant, any fathers, new fathers, this is even applicable to them. Anybody who's a support system to somebody who's pregnant, because, it's so important to be prepared for when you go to the hospital. You don't want to go and like forget your phone and then you're unable to take pictures. That's something you don't want to do. Or you don't want to go when you forget your clothes to come home with. I mean, those are things that, of course, you can wear a gown, like if you're by yourself and you don't have somebody to drive home, but it's one less thing to think about. So I'm recommending you get stuff ready, get it ready sooner than later, have your bag and all your things ready to go. Make sure you communicate. Make sure, again, if you're doing a birth plan, that you communicate that with your OBGYN so they're aware of what your expectations are and they're able to answer all your questions. Of course, during this time too, when you're pregnant, I'm a proponent of what's called a prenatal meet and greet. This is when you meet a pediatrician. You can meet as many pediatricians as you want just to get a sense of their personalities, how their office flows, their call, things like that. See if you get along with them, because I feel that rapport with your pediatrician is very important, to feel like you're comfortable speaking with them and asking them questions. So important. So again, I hope that you enjoyed this episode of the Dr. Mom Show. Don't forget to connect with me, get some freebies at drdalenemushalak.com. Also, don't forget to follow me on Instagram at Dr. Mom_show, or Facebook at my page, the Dr. Mom Show. And of course, don't forget that you are awesome. Be faithful, because God is in control. And again, today, I just want to pray for all those new mamas, all those families who are getting ready to have babies. Father, we thank you for all the new parents that are listening, that anybody who's getting close to deliver, that you will strengthen them. Lord, you will watch over them and give them the grace, patience, and strength that they need. God, we thank you that as they get ready to deliver, that you will just give them peace, Lord Jesus, during this time, that no matter how things go, God, let them realize that you work all things out for our good. And God, we bless every family who's listening. We bless every family and who is about to expect a baby. And we also bless every baby who is about to be born. And we just thank you for their hospital stays, that it will go well, and their deliveries, that it will go well and smoothly. In Jesus' name, amen. So again, don't forget to wash your hands, kiss your kids, love your families, and say your prayers. Good night. Love you guys. Take care.